Basically, we decided to use the same composite index in order to measure the socioeconomic deprivation of the patient. This poster is instead based on another database, which is Michigan database. Michigan database is a national database here. Yes, an American database, which is basically part of the SEER database, which is maybe much more famous. But Michigan database has the ADI as a variable. This is why we decided to use this data set, because we needed the ADI for these patients in order to measure, I mean, in an objective way, the socioeconomic deprivation. And what well, this poster is, I mean, a little bit of controversial, because I was working on this project, and I remember that in those weeks, an important trial was published on New England Journal of Medicine about the lack of association in terms of survival between an extended lymphadenectomy for radical cystectomy compared to patients who did undergo extended lymphadenectomy. But I mean, I think that this abstract got accepted because reading more carefully the trial, if you look at the number of nodes of the median nodes removed in the cohort who did not undergo to extended lymphadenectomy, we are talking about, I don't remember the exact number, but we are for sure above 20 nodes removed. And if we look at all the retrospective series US based on the topic, the median number of nodes removed is much lower. So I don't think that the trial is really representative of the actual clinical practice, especially in the US. And so this is why, for example, I chose a cutoff of 15 nodes removed in order to decide whether a lymphadenectomy can be considered adequate or inadequate, because this is what usually happens, especially, for example, with multi-port surgery, multi-port robotic surgery, and it can be it can be also even more different with single port surgery, because the number of nodes removed is usually much lower. So this is why I think that this poster can be considered still significant. And what we have found out is that socioeconomic deprived patients are less likely to undergo an adequate lymphadenectomy.